Hello, good afternoon. How is everybody? I'm Tony Hong. I'm an Associate Professor of Communication Studies. I recognize many of you. My colleague, Dr. Foley, and I are really excited to again bring you this exciting event with the Women's Health Fund. It never ceases to amaze me what great panelists, what great speakers we have, and the information is just so valuable to all of us. And so what I'd like to do is, we have a little bit of a different style today. Rather than having one guest speaker, we have three glorious guest speakers and one moderator. So what I'd like to do is turn it over and introduce Ms. Lauren Dawson from the Women's Fund, and she will conduct the rest of the event.
Good afternoon. It is technically afternoon now. My name is Lauren Dawson. I am the Curriculum and Collaboration Coordinator for the Women's Fund. This is our third in our series of women's health lectures with UHD this semester. And we are talking about minority health awareness. It is Minority Health Awareness Month. You guys have some really cool events, and some of the hallways here are related to that. So hopefully you'll check those out as well. I just want to thank, again, Dr. Hong and Dr. Ashley Archipoli for partnering with us and helping make this happen. So for those of you who are not familiar with the Women's Fund, we focus on empowering Houston area women and girls to be advocates for their own health and wellness. We have been doing this work for the last 40 years, so we're celebrating that anniversary. And we now reach close to 12,000 women and girls each year by providing free curriculum-based health education classes, seminars like this one, half-day workshops, public lectures, and other presentations, as well as our 4 publications. And we did bring copies of our publications if you would like to take any of them. We can talk about those later. All of our services, all of our publications are provided at no cost. And we're really excited to continue this work and continue our partnership with UHD with this lecture today. And we would also like to thank our partners at Kelsey-Seybold, at Hope Clinic, and with Harris Health System for providing the expertise and our 3 brilliant panelists for today's discussion. As a reminder, we do appreciate feedback, so at the end of the presentation, we will have an evaluation for you to fill out, and if you could just hand it to one of the Women's Fund staff members, that would be appreciated. And when we get to the Q&A portion, if you could come to that mic right here and speak into the mic so that we can capture it. We are live streaming on our Facebook and on UHD, so speak into the mic. And then I'm gonna actually have the panelists introduce themselves and tell us a little bit about their areas of expertise and who they work with. So we have Dr. Pooja Sagal, we have June Henke, and we have Shannon Chen. So.
Good afternoon, everyone. Thank you for sharing a part of your afternoon with us. My name is Pooja Sagal. I am a family medicine physician, and I practice with Kelsey-Seybold Clinic at their downtown location. And because I'm a family practice physician, I think if all of you are aware that family medicine basically means we take care of the whole family and we take care of the whole community. So we take care of you as a whole person. And my particular interests are preventative care, and especially women's health. So welcome you all, and I'm looking forward to a very interesting and engaging discussion here.
I'm June Henke. I work at Harris Health System. My whole clinical background has been mother-baby, and so I'm here presenting on the population of maternal child for Harris County, more so than just from Harris Health System where I work. I'm a member of the Maternal Mortality Morbidity Task Force in Texas, which reviews maternal deaths. And I'm also on the Texas Collaborative for Healthy Mothers and Babies, which is a quality improvement collaborative looking at the whole of Texas to help improve outcomes for mothers and babies. Plus, I work with many organizations within our county that support and work with moms and babies.
Good afternoon. My name is Shane Chen. I'm the Chief Operating Officer of the Hope Clinic. The Hope Clinic itself was established by the Asian American Health Coalition. So I spent many years working with partners such as June and various other community-related, health-related entity. So it doesn't just stay over at health. We usually go beyond just the health aspect, social service, the education aspect, because every component, we're all tied to each other. Hope Clinic is what's called federally qualified health center. We provide primary care and preventative services, such as pediatric services, OBGYN, optical. We have a partnership with UH College of Optometry to provide eye care. In my day-to-day role, I take care of operations, programs, deciding some of the disparities in the community, and as well as what we can do to address the needs of the populations.
Thank you. So to kind of provide a framework for our discussion today, we decided to look at the concept of health disparities. I know that's a very large block of text, but wanting to define what health disparities are. So health disparities are a type of health difference that's closely linked with social, economic, and or environmental disadvantage. So it's when you have a difference between outcomes or prevalence, morbidity, mortality with various measures, and that is caused, the difference is caused by social, economic, and or environmental disadvantage. So health disparities adversely affect groups of people who have systematically experienced greater obstacles to health, and that can be based on racial or ethnic group, religion, socioeconomic status, gender, age, mental health, cognitive, sensory, or physical disability, sexual orientation or gender identity, geographic location, so rural versus urban, or other characteristics that have been historically linked with discrimination or exclusion. So this definition comes from the Healthy People 2020 initiative, which is a governmental initiative by primarily NIH that is working on trying to close the health disparities, close the gap on health outcomes. So with that definition in mind, for our panelists, how do health disparities affect or relate to the population that you serve? Or how does it relate to minority health more broadly? Any volunteers? I'll start. Yeah.
So on one end, on the health advocacy and health coalition aspect, we're finding out a lot of times minorities are underrepresented, either with women, either it's specific, ethnicity or religious group. Based on what they are experiencing, whether it's culturally or within the home life or socially, a lot of times their information probably is not shared or it's not as well known. So that impacts how doctors, how the system provide their care, and ultimately impacts their own health. A lot of times they have low health literacy, which means they themselves from the get-go, because of a lot of challenges that they face in the social, financial aspect, has not been getting proper care, and therefore are not as accustomed to understanding prevention, early detection of certain chronic diseases, and healthy lifestyle, healthy mental healthy wellness. For us, Hope Clinic, we provide care to a lot of the refugees and immigrants from all over the world, and especially people who are actually refugees who are very vulnerable because they came from very specific background. A lot of them had grown up in various camps. Coming over to the U.S., they're so used to kind of a more certain type of lifestyle, to where now they have to learn how to assimilate to new language, new culture, new expectations, finding jobs. Health is usually the last thing on their mind, and a lot of times they themselves don't take care of themselves. Not only that, their kids are not vaccinated on a timely basis, not signed on to insurance. They let their Medicaid or let their chips lapse because they forgot to renew, and they need extra hand-holding.
I'm going to talk about some of the numbers, because I think if we don't know that health disparities exist, then we can't take action towards them. So in my realm, one of the items that has received a lot of publicity and media is maternal deaths. And that statistic is that in the whole of the United States, for every one Caucasian woman that dies, about 4 Black women die. So that's a disparity. Another huge disparity is, but then I have to say for Texas in our 2012, our rate was 1 to 2. When we first started looking at maternal mortality and looking at the numbers and delving into it, somebody asked me, like, what is our maternal mortality rate? And I thought, oh, we're in the United States, ours is gonna be good. Well, we started going into it and we went, oh no, it is not very good at all. But until we started to look at those numbers and pay attention, people were not paying attention. People weren't doing anything. And I think throughout the conversation, we can talk about how, because of knowing those numbers and bringing that awareness out, we have had a number of things that happened. And also, there's a number of aspects, like for care, like my co-panelists, they provide care. Well, getting women into care, again, to get into prenatal care, the number of women getting in there's quite a disparity. Percent of mothers get in the first trimester. The healthy people want at least 77%. But then we look at the difference between Caucasian and Black women. There's about a 20% difference. So when I present the numbers, I present to community and I say, then okay, now it's up to us, the community, to take a look at what are the reasons behind this and start making the changes. Also with our infant mortality, there's again that same disparity, and then it goes on for a number of things. So I think once we know them, then we can start to work on them. And I also track them, so I can tell people if we're getting better, or we're getting worse, or staying the same.
So, I'm going to talk more broadly about disparities in all the minorities in not one particular group, and I'll try to keep it more generalized, because to me, whether or not you want to accept it, the disparity exists. So when we talk about disparity, I think disparity exists in health, and disparity exists in health care. So the difference is, when we talk about disparities in health, it pretty much means the difference in the disease burden in different classes. So you could compare African Americans and Hispanics to whites. And when we talk about healthcare disparities, it means access to care and the quality of care. So, all across the board, and if you look at different reports, you could see, Census Bureau reports and other reports, it's really, gut-wrenching to see the numbers. I have some numbers, I don't remember the numbers, so I'll have to just give you some numbers of 2015 Census Bureau reports, and it's really sad to see that death rate for African Americans is higher than whites for all chronic diseases, heart disease, stroke, cancer, asthma, HIV, homicides. And 55% of non-Hispanic Blacks, in comparison to 76% of non-Hispanic whites, have private insurance. Private insurance is important in the sense that we really think that people who have insurance may have more access to health care. Hispanic population is 39% of the population in Texas, but this group is minority group because this population has the least insurance coverage. I think it comes out to 47% of private insurance of all the other ethnic groups. So that can also, convert into their access to quality care. And if you look at Hispanics, so Hispanics are more, if Hispanics have diabetes, they are 3 times more likely to end up with end-stage renal disease compared to non-Hispanic whites, and they are 1.5 times more likely to die from their diabetes. So I think this is how bad the situation is. And when we talk about disparities, it doesn't only affect the minority populations. If we do not address disparities, the problem is it results in overall decrease in the health of a population, and we end up using more healthcare dollars for our overall population. So that's why it becomes very important for us to address healthcare disparities, so that as a society moving forward, we could improve health for all.
Thank you. Each of you have touched on a different aspect of, you can't see the slide behind you, but the concept of determinants of health. And so Shane mentioned health literacy being an issue, that if you have a lower level of health literacy because you've never learned this basic terms, basic language that we use to talk about health and healthcare, people can give you a number, give you an A1C number, but if you have no idea what an A1C number means, that number is useless to you, right? We talked about gender, and we talked about race. We talked about the support networks and access to health services, access to health care. You also touched on the issue of culture, the issue of socioeconomic and financial status. All of these are parts of those core determinants of health that are going to influence a person's health status. And then I'm so glad that you also touched on the fact that when something impacts the individual, it is going to have a broader impact as well. So we have an individual that is maybe more vulnerable, you're genetically predisposed to developing a chronic condition. You then place them in an environment that adds additional risk factors, additional stress, and then that is going to spread out to the community around them. So within your populations that you look at, what are the issues or diseases that are of greatest concern to you?
Sorry, normally I talk very loud, so I was like, I have to use the microphone. I forget. So for myself, first and foremost are children. Children are actually very important because, as they grow, if you can actually start from the beginning to make sure that they're vaccinated, that they actually get their well child, you monitor their development. As they're growing into adolescent and young adult, then we can address things early on. And maybe control a lot of the further costs down the road to prevent childhood obesity, to prevent development of early diabetes. Those kind of things we try to work with parents, but a lot of times based on parents' knowledge of how to serve them food, how to basically bring them on a timely basis to get their annual checkup, dental checkup, eye checkup. It impacts kind of like the rest of the family as well. We did one particular project before, which is very interesting. We took parents to supermarket, and a lot of times the kids would tag along, and we're teaching them how to read nutritional labels. How many of you guys really read nutritional labels? Excellent. When you're comparing food and everything, even though this is a name brand, sometimes it's indicating, the organic whatever, special brand, name brand. But if you look at the sugar content and the sodium content, a lot of times they're a lot higher and they're less healthy than some of the non-brand. And we're encouraging parents to shop healthy and encourage your kids to make good choices. And it's amazing because we took them the day before Super Bowl, and everybody's first thing in their mind is chicken wings and soda, and the big bottles of soda. And we're asking the parents, well, think about it. Whatever you do, you get the seltzer water, the flavored seltzer water, not the juice, not the Coke or the Pepsi. I'm not endorsing any particular brand right now, but make a lifestyle change. Add a squeeze of lemon into the flavored soda, and it's still effervescent and icy. So we're helping families to kind of learn about taking care of themselves. Another vulnerable population is actually women. A lot of times women put themselves very last. They're moms, they're working young ladies, and a lot of times they themselves don't take care of themselves first, they take care of others. They're nurturers. So women tend to forget that I need to get prenatal care on a regular basis. I need to make sure I get my annual pap smears. I need to make sure that I get vaccinated as well and get my annual checkup. So women are actually very vulnerable to the delay of early detection as well as chronic diseases.
I would say one of the items that I think is most pertinent is cardiovascular health. And that crosses all spectrums. Like say, you all right now have the chance to make sure that you stay healthy as a person, because that'll impact, your whole life in the future. And then for the ladies in the class, if you choose to become a mom, hypertension and heart disease actually are among our top killers of women. And sometimes it's not that dramatic, big thing that you see in the newspapers and the hospitals, because a lot of times it is after their Medicaid has run out and they don't have the access to care. So this is where it goes back to family practice, like having access, having that insurance, being able to see a provider, making sure that you have your health under control. And then it's all those other things, is like the activity. It goes back to a lot of those social determinants, like what is our community like? Can we exercise? Can we get the right kind of food? And so I think that is one of the ones that I see is a really important issue, because when the mother has high blood pressure or cardiac problems, they often end up delivering the babies early, which results in a preterm baby. And the other thing I think is knowledge and being aware and knowing what signs and symptoms that, like after you have a baby, what are those, or while you're pregnant or after you have a baby, what are the triggers? What do you need to know? And this is where all the men come in too, because you all need to know too, like what do I need to know to help my partner? What do I need to know? And when if she isn't listening, what do I have to take the moves to make sure that she gets the care she needs? So those are top things for mine.
I agree with other panelists. Really, for me, I practice in downtown area, so I get wide variety of patients which have, medical insurance from good private insurers versus somebody who just walks in and has no insurance coverage. So all across the spectrum, as June said, it's cardiovascular disease, which is really, a big health issue in this country, and number one killer for both men and women. And cardiovascular disease is kind of a constellation of things. It does include your heart disease, it includes your high blood pressure, and to some extent you could lump stroke into cardiovascular disease. So number one killer for both men and women. And the sad part is that even though this is number one leading cause of death in this country, it is also the number one preventable cause of death. So, if you could take care of your health at this age, there is almost a certainty that you would not develop cardiovascular disease early, and there is a fair chance that you will have a healthy life. So I think for me, it's health literacy is very important. It's educating people like you when they are young. It's educating families. It's educating everybody in a society to make them understand that prevention is really the key factor that could really help you later on and decrease your chances of having a decreased quality of life due to any of those cardiovascular conditions.
My next question is specifically for you. You've actually done a talk here on the impacts of stress on the body, and so I pulled some of your talking points. And so I was wondering if you could just give us a little bit of an overview of how stress and stress response impacts the body, and especially in the context of chronic stress, that the damage that chronic stress does to the body and the influence on chronic disease.
All right, I'd like to answer. It's a very broad question. So when it comes to stress, I'm going to talk to you very general, and then a little bit more specific about minority populations. So stress has been determined by WHO as one of the top 10 determinants of health disparity. So it should make you think about how important stress plays a role in our health and disease. Chronic stress especially means that, you were exposed to an environmental trigger, and then your capacity to deal with that trigger was not enough, and it led to the stress. So stress basically means there are some physiological and biological changes, and stress, remember, is always bidirectional. Chronic stress to the body can affect you physically, it can affect your mood, and it can also affect your behavior. So I'll give you a few examples. When I talk about it can affect your physical health, meaning people can have muscle aches and pains, they can have stomach cramps, they just feel tired all the time. A lot of times these people will present to doctor's office with what we call psychosomatic symptoms. They'll come talking about headache, and you could run all the tests and you could do CT scans, but unless you really know that person's, what we call social determinants of health, where is this disease coming from, you're not going to make a good diagnosis because, their headache may really be related to stress. In fact, a lot of ER visits for chest pain are anxiety related. Not everybody who ends up with a chest pain has heart attack. A lot of times it's a panic attack, anxiety attack, which really you could say that is coming from stress. When it comes to mood, chronic stress makes you feel restless, agitated, anxious. So it could also lead to, your more depression and anxiety-like symptoms. And also, chronic stress has been known to cause negative behaviors, health behaviors like increased abuse of alcohol, smoking, drugs, and these are the people who are going to be more physically inactive. When it comes to more minority populations, studies have shown that some of our racial and ethnic minorities and people with low socioeconomic status live and work in environments that create more stress, but these people do not have material or social resources to fight this stress, or they do not have resources to go to where they can get some help to deal with this stress. An example would be having counseling services, having access to psychologists, or not even that, maybe having access to somebody in the community that in churches where they could go to and get some help and maybe be directed to see physicians later on if that is causing some health problems. A lot of digestive diseases, stress ulcers is a term if you've heard. It is not necessarily due to just emotional stress, but physical stress to the body can also cause gastric ulcers. So it could really cause a lot of disease and sickness. The other problem is, you may have heard somebody was stressed and got a heart attack. And the truth is that chronic stress does lead to the increased risk of cardiovascular disease also. People who are chronically stressed, their rate of death due to a heart disease is more than somebody who has heart disease but was not as chronically stressed. So does that answer your question? Okay.
Anything to add to that? Thank you. So with all of that in mind, you each work in the health system in different capacities. Physician, looking at the entire health system, all of the numbers, looking at providing care and services. So within your role, what is it that you are doing to try to address minority health needs and challenges of health disparities? What does that look like within your specific role?
Mine, as I've already said, is the numbers. I present the numbers to our community. I go to many different organizations. I do presentations. As people are aware and know what they are, this gives them the opportunity to look at them. Also, I consider myself a networker and a connector because I do go to many organizations and because I sit at the state level meetings. That allows me to bring back initiatives back to us. And so we have an impact collaborative, and we do present our data on a yearly basis so the community knows. And people come throughout the community come to me for my data. And I also do maps. I do GIS mapping, and I map our indicators for the county so I can say where in this community things are doing well, we're meeting the healthy people goals, or we are way out of line. Because you'll have a number for the county as a whole, but within Harris County, we have many communities that are nowhere near meeting that goal, and others that are. And again, we go back to the why.
So one thing I strongly believe is we're all in it together, we're all interconnected, and what we actually kind of emphasize, we wanted to empower the community. So providing care doesn't just happen in the exam room itself, it's actually working with local residents, working with education institutions, as well as working with the different other organizations, social, the health department, the public, the private entities. But for us, each and every one of you can make a difference, I feel like, as you guys are studying and learning more about health and social determinants, be more aware of what's going on around you. If you're choosing to go into the health path, whether it's actually more public health, whether it's actually delivery of care, be more mindful as you're providing the care or you're examining the public health aspect. how you can actually make a difference, and understanding those target people, target audience, what they're going through, what kind of challenges that they're going through before actually providing the care or taking into consideration what kind of needs they have. Let me kind of just summarize with a short story. So, for example, we had a child that came in and had rash all over its body. And the mom was like, oh, what's going on? And the first thing I thought of was, okay, there's a lot of things going on right now. There's measles, there's, the child probably ate something, it's allergy, there's a lot of stuff going on. And our pediatrician examined the child, and it turns out the child was bitten by insects, the bed bugs around at home. So it's an in-home environment, and the mom was not aware of that. So there's an infestation in the apartment with bed bugs. So changing the environment and really understanding, okay, what's going on in the house? Can that be changed out? Do you have enough money to get another bed? Can we work with a social organization to get you another bed? Making sure, because otherwise you're just prescribing certain medications, sending the child back to that same environment without treating the environment. So it's really important as you're learning for this particular class to understand the social determinant, understanding what's going on can trigger how that impacts a person's health, and let this be a takeaway, and be able to be an advocate for your family members, be an advocate for the community, and hopefully you'll join us one day in the health arena.
Thanks. June, I pulled one of your lovely graphs on here, like I had it memorized. On the top causes of maternal death, and you and I had talked a little bit offline about wanting to look at not just the numbers and the problems, but the solutions. And we have touched on some of what those solutions might look like, and I was wondering if you wanted to share any of the kind of top priority areas or solutions that you have identified with the Impact Collaborative and the maternal mortality work that you do, what that might look like.
The Maternal Mortality Task Force, our job is to review cases, so we get a lot of information. We look in depth to see what those causes were. And then we write a report and we make recommendations. And then from those recommendations, again, organizations go ahead and do things. One of the items that the Department of State Health Services has done, I think this is the deaths over 1 year. So this is all women who were pregnant in that 2012 to 2015, but that was up to 1 year. They also did an analysis, what are the most frequent causes up to, say, 7 days, because that's more acute, what's happening in a hospital. And they found that hemorrhage is among the top. So what they have done is that they have, Texas has become one of the organizations that, or one of the states that's going to be in the Alliance for Innovation on Maternal Health. And what they do is they have a specific, it's called a bundle, and what it does, it asks hospitals to be prepared to deal with a hemorrhage if you have to deal with it. They want them to be ready. So take a look at all your practices ahead of time, know what you need to do drills, etc. Be able to recognize it when it happens to the mother, and then respond when you see it's going on, and then report and make changes. And we have 207 hospitals within the state of Texas that have signed on to do this bundle. And that covers like 97% of the births or something like that. And Texas also, that's about 8% of the births in the whole of the United States. So that is one initiative. There are many legislative bills going forward this session that would help. One of them is to extend coverage for women on Medicaid. Like 54% of the moms are on Medicaid. So this would allow them to have coverage for up to that year to cover some of those chronic health issues that may impact on their well-being. I know one of them is 11, I think Sarah Davis, 1110 is one of them. There's a number of those bills. So that's where you could each, become involved. Like if you're interested, if you support it, you could call your legislative reps and senators and say you support it and why, because that will make a difference. we do have that perinatal collaborative within Texas, which is also looking at what else do we need to do to improve. We'll look at obstetrics, neonatal, within the community, and then data. Data is another part. But our community one is working on one key question, and that is asking women, do you want to become pregnant in the next year? We want, you know, as many clinics as we can get involved, asking that question to women, and then help them meet their needs based on what their answer is, yes, no, or I don't know. Impact is a local collaborative in Harris County that has organizations and individuals, and we work on a number of initiatives for maternal and child health.
Thank you. I actually pulled a quote from one of the reports that you sent me from the Black Mamas Matter Alliance that says, care partnership is an essential part of building trust and effective two-way education. Providers need patients to educate them about their bodies, concerns, medical history, conditions, desires, and lived experiences. In order to do that, patients need providers who listen. So I really loved that, obviously. And, you know, being able to ask, do you plan on getting pregnant in the next year? Allowing that to be, what are your desires? What is it that you want? How can you plan for that and plan for your health? And I know that that is also part of the communication with your population, Shane, and working with refugee and immigrant communities and multi-ethnic communities. So what does that education, two-way education and communication look like for your population?
So we're finding that language itself is actually very important. A lot of time culture is very important as well. So providing the education itself, you have to be very sensitive. What kind of background are they from? Is there a particular social or religious or cultural barrier that you're broaching the topic that might be offensive? We're finding there are times that we're talking about mental behavioral wellness with postpartum women, and the questions that we're asking, some of the women from certain culture will find it very highly offensive. Why are you asking if I feel sad or if I feel hopelessness? You know, this is none of your business. You know, so we take a lot of the culture as well as where the women's from, what kind of environment that they're in, into account when addressing how to provide them with proper care. As you can see back here, this is actually just various aspects of our clinic. We provide services in over 31 different languages, and we also, it's because we hire from within the community. We believe in actually providing the economic development for various population, various areas of our service area to make sure that there's jobs and there's opportunity for those who are wanting to provide services to a special population. We have staff that speaks multi-language, 3 or 4 different languages, such as you have the dialect of Burmese that has a special regional dialect like Chin, Karenni, Karen, and a lot of times it's kind of challenging because you have people who actually are Rohingyans that speaks very little Burmese, very little English, and you still have to be able to find interpretation, provide the care for them as well. When you really understand what the doctor's communicating with you, like please take this medication on a daily basis and make sure you don't skip this medication twice a day, 3 times a day, or monitor your blood sugar on a daily basis because it impacts your baby. Do they really understand? Do they understand the severity or the impact of not complying? And if they really didn't understand, the doctor, So when they go home, are they really going to take the medicine? Are they really going to monitor their blood sugar, right? So we're finding that having nurses, having physicians, having like translators, the patient assistants that actually can communicate and really understand get that understanding from the patient. Oh yes, I understand now. It helps us improve the patient's health.
Thank you so much. and I'm gonna have this as an open question to all three of you. We have touched on several different areas based on your areas of expertise about how to move towards health equity, which is about closing that gap, closing those gaps in health outcomes, in access to appropriate health care, access to care in the language that you speak, being able to stay on your health insurance, how to reduce stress, how to reduce the stress in your environment and cope with personal and external stressors, and how that impacts your body, your family, your community, etc. And so just for all three of you, what are initiatives that you have seen so far, whether small scale or large scale, that have had the biggest impact on moving towards health equity, closing some of those health disparity gaps, and improving health outcomes for your patients?
I'll try to answer as best as I can. When it comes to seeing interventions that would close that gap, it has to be done from a family perspective in the community and more broadly from, a federal perspective. To me, when we had, when we implemented Accountable Care Act, I think that was a good thing because it did increase the, coverage, or it expanded healthcare coverage to some of the communities which were otherwise considered minority communities. So I think that is good. So Department of Health and Human Services has also opened up an Office of Minority Health, which is also trying to close that gap. But as I said, this starts with an individual, then a family, and then goes at a more broader level. So interventions that I have seen help is having a physician being culturally and linguistically sensitive to the patient's needs first. When a patient comes in, you have to go by certain basic social determinants of health with the patient, and there are online tools that are available. A lot of doctors' offices that use these electronic health records, they have those inbuilt in their systems where they could ask them basic questions about their food, about housing, about utilities, whether they feel threatened, in their community. Based on stuff and based on very simple yes or no answers, we could pretty much move forward and know whether this particular patient or this particular community needs a little bit more help. But this is a partnership. It's just not one size fit all. There's not one person who could help change all this. So I think it takes a team. In our clinics especially, we have social workers. If we identify a particular group or a need, we have social workers who could help our patients locate some of the community resources where they could get help with, I think, housing and food and just baseline paying for their utilities. And also, let's say if somebody has issues with trying to eat right, we have dietitians available. So, it is not one person or one group that can bring the change. I think it's all of us as a society. I mean, you as students, your universities, local and governmental, health agencies, everybody has to be together in it, because as I said, we are aiming for health for all, and we are aiming for health equity. So it's going to, take all of us to work towards that goal.
Anything you want to add?
I would like to say yes to the big picture. Like, I think there's the working individually with each individual person and respecting them. There's also working at that big high level policy level, because the policies our government makes impacts us greatly. Like I said, with our maternal mortality, we started out telling the community, these are the numbers. We got legislators involved to create that task force. It didn't happen the first session we went up to Austin. It happened the second one. But because of that being developed, from them, there has been so many initiatives to work to decrease maternal mortality and morbidity. And now we do have a subcommittee within our task force that's going to look at the health disparities part. But it took the community getting involved, it took the policy, the high policy level, so that we can actually impact what happens at a clinic level and at an individual level.
So I agree with June. It's what the change itself is not just at the community level, it is actually at the upper level as well. each and every one of you can actually make a difference. Go vote. Be sure you register to vote. That's very, very important. As well as when you have a chance, really understanding who is representing you, and tell your story, tell your family's story. Be an advocate, be the champion of those that you love, because a lot of times it's you telling the story of what kind of barriers that you had experienced, what kind of the challenges your family had experienced, that really will, the system itself really will change. But for us over at the clinic, we do it both way as well, but we also believe in working with the community to transform a bit at a time, not in the exam room again. So, for example, out in A-Leaf, where we have 2 of our clinics out to serve the A-Leaf population. How many of you guys know where A-Leaf is located in the southwest part of town? So, the A-Leaf itself, we actually have a kind of a separation of City of Houston as well as the Harris County the jurisdiction. So once you go beyond the City of Houston jurisdiction, a lot of the county aspect, there's no sidewalks. There's not as much the ordinance or regulation. It's very different. So we work with the A-Leaf Independent School District, the A-Leaf neighborhood, and the local businesses, and we're putting together a walking sidewalk, walking trail, chess table for the seniors. We're transforming just the environment and bringing more activities, kite festivals, like a health safe street day, to make sure that the neighborhood itself, the people itself, have a safe, have a place for them to really exercise, and the lifestyle is transformed. So transformation happens in the population, in your neighborhood, and goes just beyond the walls of the clinics.
Thank you. I don't know if you guys have any questions, but we could probably take 2-ish questions. So if you have a question, the standing mic in the center of the room. I know there's a lot of pressure.
I'll go first.
Yeah.
So, thank you all again. Oh, hang on. Just make sure that's on. Okay.
Thank you again for joining us. My question is about working with the community. What, if any, initiatives are there working with schools? You just mentioned the school district, but actually having information distributed through the schools, because kids a lot of times teach their parents and their families about healthy eating, about diet and exercise. Are there any initiatives where kids are informing their families and their parents about some of the things that they should be doing?
So we ourselves, as well as many of the other agencies in the greater Houston vicinity, has activities and educational workshops. You can always actually kind of engage them. There's always volunteer opportunity. www.hopechc.org/career volunteer. So, get involved, get involved with local agencies. A lot of times there's also, we work with the schools as well to kind of bring in opportunity to learn a little bit more about women's health, about the various chronic diseases, cancer, and I feel like the knowledge itself is the biggest strength for everyone. Having that understanding, get involved socially with the student organizations here, and changing even the your school. How can the school be healthier? How can the school be a more viable place? So other than yoga classes, having maybe even like a garden area where the students can hang out and maybe work on the garden itself, planting tomatoes. Transforming the places that you work, the places that you actually learn, that's actually ways the students can get involved.
I feel like that was also an opportunity to talk about the Women's Fund, because that's actually a large portion of what we do. We are always accepting volunteers. We do go into schools all throughout the greater Houston area and provide health education curriculum. So we have a 10-week course for girls. We also have 1-hour informational classes that we do on a wide range of topics. So we work in HISD, Pasadena, Fort Bend. We've worked with A-Leaf some of the charter schools, private schools, and really anywhere that they ask us to go, spring break. So our initiative, and then, yeah. Any other questions? Okay, well, thank you all so much for being here, for listening. Thank you so much to our panelists, and all of the organizations that helped put this event together. If you have questions that you just don't want to walk up to the mic and ask, you can come up and ask us. And thank you again to Dr. Pooja Segal, to June Hankey, and to Shane Chen. And have a great rest of your Tuesday. Is it Tuesday? It's Tuesday.
Love taking classes, so you know.
Yeah. Thank you. We have the evaluation forms. If you could fill those out and then hand them back to one of the staff members, or you can leave it on the center of the table and we'll pick it up. We really appreciate your feedback. And yeah, thank you all so much.